the mental health sector is fairly, diverse. Or on the one extreme end, people who would need, who are suicidal, they would need, some kind of housing options or some kind of, stay options or something very high end medical support or clinical support.
Yes.
On the other end is very light touch, probably, initial mental health, which is not diagnosed or undiagnosed both ways. So, but not all of these challenges are supported or funded or managed in some way or form. So how do you see the role of the governments, the communities, the local organizations to not just the one which is diagnosed and managed, but which is undiagnosed and unmanaged and unknown?
So much of the funding within the mental health sector goes to like crisis support, right? And there's very little from my own experiences in the work that I've done in the sector that goes right on the front end to what can we do to help people and prevent them going through this journey, which is what's big for me, is that preclinical prevention stage rather than getting into that clinical crisis support. It's a quote by Desmond Tutu that it says at one point in time we need to mess that one up.
It'll come back to you.
It'll come back to me, yeah. What is it? It's at one point in time we have to stop pulling people out of the river and go upstream and find out why they were falling in or something like that.
That's a good reason. Yeah, good line.
I'll go back to that.
That's fine. That's fine. But you were talking about the mental health funding is crisis support only.
Yeah, so much of that mental health support funding goes to crisis rather than prevention, rather than being proactive and working out what you can do to assist and support people in the community before they reach that crisis stage. There's lots of organisations, and in fairness, more and more of them that are doing really good work that I've seen in Perth are operating at this level and in the pre-crisis support services space. I was mentioning a moment ago that quote by Desmond Tutu that says at some point in time we have to stop pulling people out of the river and go upstream and work out why they're falling in rather than,
Yeah, I think it's a good prevention, as you said.